Cancer screening can save lives. Screening for cervical cancer is continuing across Leeds. Extra Covid-19 precautions are in place at GP practices for your safety. If you are due your screening test, don't delay making your appointment.
This video will show you what happens at each step of your cervical screening test and some of the extra safety measures that have been put in place to reduce the risk of spreading coronavirus.
Cervical screening is not a test for cancer. It is one of the best ways to protect yourself from cervical cancer by detecting and treating changes early. That's why it's really important to be screened every 3 years between the ages of 25 to 49 and after that every 5 years till the age of 64.
When you receive your letter telling you it is time for your cervical screening, you should contact your GP to make an appointment. If your first language is not English, please let the receptionist know if you require an interpreter when booking your appointment. Do not book or attend a cervical screening appointment if you or someone you live with has coronavirus symptoms. Appointment times are carefully staggered to maintain social distancing and to allow for cleaning between patients. Please attend your appointment at the stated time. You should come alone, and on arrival you should wear a mask over your mouth and nose. However, if you need help from a carer or are exempt from wearing a mask for medical reasons, please let the receptionist know when booking your appointment. When you enter the building, please use the hand sanitizer provided. If asked to go to the waiting room, you will sit 2 meters apart from other patients. Your nurse will be wearing PPE, which means a mask, apron and gloves. This is normal at this time and will not affect your nurse's ability to carry out the test. The test itself has not changed and only takes a minute or two, although the appointment will last about 10 minutes. A female nurse or doctor will usually do your test, but if you want to make sure, ask when you make your appointment. You will accompany a nurse into the treatment room where they will go through some information with you and answer any questions. Anything discussed will be kept private and confidential. Your nurse will then give you a private space to undress from the waist down, and you will lie on your back on a couch with your knees bent and apart. There will be some paper to cover yourself with. The nurse will not allow anyone else in the room for your privacy. The nurse will use a new, clean speculum to gently open your vagina. This is the part that some people might find uncomfortable, but it doesn't usually hurt. Once the speculum is inside your vagina, the nurse will gently open it and use a small, soft brush to take a sample of cells from your cervix to be sent to the lab for testing. This might feel a bit strange, but should not be painful. The nurse will then give you a private space to get dressed. You will sanitize your hands and leave the building, following the exit markers and signs. The room will be thoroughly cleaned and prepared for the next patient. Although you might bleed a bit afterwards, you can carry on as normal straight after your test. Your nurse will let you know when you can expect your results. Remember, around 7 out of every 8 cervical screening results are normal.
We are committed to patient safety and are confident that the measures we have put in place will keep you safe. If you have any questions or concerns about your screening test, please talk to your practice nurse or GP.